So just a summary on the types of admission to a mental health facility under the Mental Health Acts. And there are essentially two types. There's voluntary admission and involuntary admission. So let's begin by looking at voluntary admission. So when you understand that the nature of mental illness means that, for example, when someone has schizophrenia or bipolar or major depression or whatever it might be, there are times where they are well, and that means that the person, particularly when they've had a long sustained mental illness that they've lived with for a long time, they do sometimes have insight, for example, when they're becoming unwell. And that's when they can make an application to become a voluntary patient, and they can actually choose themselves to be admitted to a mental health facility. Alternatively, if a patient or a person whose carer under the Guardianship Act looks after them and they think they're becoming unwell, they can make that application to be voluntarily admitted. So once they're admitted, and an AMO or an authorised medical officer must decide that the person with the illness, that it would benefit them to come in to some inpatient care and to receive that treatment. And importantly, in terms of their rights under the law, they have the right to leave hospital or discharge themselves at any time. And if, for example, they believe that they're becoming unwell and they make application to be voluntarily admitted, and one AMO says, no, don't think you would benefit, they do have that right to appeal so that they can seek further assessment. So voluntary admission is obviously fairly straightforward. So we'll look at the next type now, and that's involuntary admission. So involuntary admission is obviously more complex in that the person has been defined as mentally ill under the Act. So remembering it's about care, treatment and control. And if they are defined under the Act as having a mental illness, and then they are presenting a danger to themselves, a danger to others or the public, and there's no other least restrictive care options available, then they can be put into hospital involuntarily, or scheduled under the Mental Health Act. And the same with someone who's mentally disordered. Remember, it's more transient. It could be a one-off incident. Someone becomes acutely suicidal following an incident in their lives, and whenever they are a danger to themselves or the public, then they can be involuntarily admitted. Now, it's important that you really review, just from a very basic perspective, just the times that people can, the length of time that they can come into hospital, and the ways that they can be admitted. So this is covered, and I think look at your Mental Health Act guidebook. Obviously, when an authorised medical practitioner or an accredited person, which can be a mental health nurse, believes that they can initiate this admission process for involuntary admission through the police. And I think when you look at the case of Kevin, that's an example, at the request of a friend or their primary carer, order of the court, breach of a community treatment order, which I'll talk about very soon, and transfer from another health facility, and obviously after being brought in by a paramedic through to an emergency department. And it's worth noting that in New South Wales, all emergency departments are classified as a mental health facility. So, obviously they're specialised units, but for the purposes of assessment, initially, that emergency departments qualify under the law as being a mental health facility, just for the purposes of assessment. So once the admission process is initiated, it's then important that the person is assessed correctly, because that will determine whether they indeed meet the criteria for mental illness or mental disorder. And when we look at the length of stay and what can happen, under the Act, if you meet the criteria for mental disorder, for example, you might only have to stay for 3 days, and then it's a different process when you are mentally ill. But once a person has been brought to a declared mental health facility for admission as an involuntary patient, it's really important that a number of medical exams are undertaken, and that's mandated under the Mental Health Act, because that needs to be carried out in order to permit the person's ongoing detention in that facility. So, for example, there's the first examination, and that must be within 12 hours, and it must be conducted by an AMO, an authorised medical officer, as soon as possible, but within 12 hours. And where the person is found to be neither mentally ill or disordered, for example, they're just a public nuisance, they must be released. But when the person is found to be either mentally ill or mentally disordered, then they must be seen by a second doctor. And that second examination must be by a psychiatrist and must occur as soon as possible. And at least one of those doctors finds that the person is mentally ill, then they must be reviewed at a mental health tribunal. And that's usually when there's a video link up. It's, the person appears before the tribunal. So for that second spot, where both agree that the person is mentally disordered, where it's a transient thing, remember someone's suicidal following a breakup, then they can be detained for up to 3 working days, and so on. Third examination by a psychiatrist, the decision made by the third doctor determines whether the person is discharged or detained as either mentally ill or mentally disordered. I understand that this is quite complex, but I think if you look at the Mental Health Act guidebook and just have a very rudimentary overview, that understanding that involuntary detention under the Mental Health Act, very, very serious, and there must be appropriate examinations. And I think depending on the definition or what you are diagnosed as having, whether it's the disorder or the mental illness, that will determine your length of stay. So let's just look at when you are diagnosed as having a mental disorder, then you can be detained for 3 working days. And you must again be examined every 24 hours by a doctor. Now, the better way to think of this is, I think, you mustn't be detained for a continuous period of more than 3 days, not including weekends and public holidays. And as I say, you've got to be examined at least once every 24 hours by an authorised medical officer. And if you are determined not to be disordered or ill, then you must be discharged. Okay, and a person must not be admitted or detained as a mentally disordered person on more than 3 occasions in any 1 month. And with both situations, whether mental illness or mental disorder, an interpreter must be provided where appropriate. And in fact, when you're determined as being mentally ill, of course, the more, long-lasting, situation, and that's where you'll appear before the mental health tribunal or inquiry. You must have legal representation. This is very clear under the Act. So again, in the old days, you were thrown into a mental health facility, you had no rights, And then, for example, the local hospital here would be Bloomfield. You could be just placed in Bloomfield, and sometimes in the past people have just been left and forgotten. So that again is why the Act is so important in making sure that this doesn't happen. So when someone is diagnosed as having a mental illness, for example, schizophrenia, and they are demonstrating that they're very dangerous to themselves and others, and they need care, treatment and control in a dedicated mental health facility, appear before a tribunal, because it's a legal order that must, sanction their involuntary admission. They've got to have their own legal representation. They must be medicated, or should be medicated at the minimum level possible, appear in their street clothes, and you think, well, why is that there? But again, in the past, people's dignity, their self-esteem, they were appeared in straitjackets, pajamas. It's very disempowering. So that's why they must appear in street clothes. Interpreter provided where appropriate, and they must be discharged if the finding is that they are no longer a mentally ill or mentally disordered person. So it is quite clear. So again, when you look at your chapter, it looks like quite difficult to read, because it's such a complex area, but just hopefully be guided by the points that we are covering. And just to finish off, I've talked about that one. So we'll go straight to community treatment orders. And what are they? Well, we talk about one of the main principles under the Mental Health Act is that patients are looked after via the most least restricted environment where possible. And that is a community treatment order. Now, for further information on the community treatment order that's in a very user-friendly presentation, go to Chapter 10 in your Mental Health Act guidebook, which lays out in very straightforward terms all the principles surrounding this mode of treatment. But essentially, just to summarise for you, people who have a mental illness where the illness is not so serious as to require detention, but they still require supervision, may be subjected to a community treatment order. Now, it has to be prescribed by a qualified medical officer, and that's usually a psychiatrist, and the treatment is provided by mental health professionals in the community. Now, an example would be a supervised medication regime backed up with social and psychological support that is all geared to enhance the capacity of that individual's self-care and their ability to socially participate. So an order for a community treatment order is made by a magistrate and is effective for up to 6 months. It can be made up to 12 months, and failure, if the individual or the patient fails to comply with an order, then unfortunately that can result in involuntary detention. So that's community treatment orders. So remember, it comes under that principle of the least restrictive. It's always thought it's better to look after people in the community, and that's that option. So we will move on just to summarise. So a lot of reading in this topic, and the chapter reading was particularly onerous, I think, but hopefully you've been able to navigate your way through, and yes, participating in the tutorials and the activities, and most importantly, being familiar with the definitions that I've highlighted is important, and that should serve you well in preparation for further examination. All right, so thank you.